Good morning, everyone. My name is Luo. I've just finished my first 6 months of my PhD journey in University of Canterbury. Today, I will present my research proposal titled Impact of Smart City Technologies on Quality of Life and Urban Livability Indicators for Residents. Here is my presentation online. Smart city technologies, such as IoT devices, AI-driven systems, and data analytics platforms, are increasingly integrated into urban environment to boost efficiency and sustainability. Increased street lights can adapt brightness according to the environment light level, which can turn them on at sunset and turn off at sunrise. They can also modulate illumination depending on the factors such as traffic flow, thereby improving reliability, decreasing energy consumption, and ensuring safety. However, this street light can also bring impacts on the residents' daily life in several ways. For example, the illumination will attract insects or nocturnal animals that will cause ecological changes, and those built in residential areas will disturb residents' sleep if the light too bright. But if the light too dusty, that's hard to ensuring safety. And some residents express their concern that the camera and sensor in streetlight will threaten their privacy. Therefore, it's necessary to evaluate how these technologies affect residents' quality of life. Do they improve health, safety, social cohesion, and overall well-being? And my study will explore these questions, focus on the real-world impact of smart city projects on urban residents. After finished preliminary lecture review, we found that most of study on the impact of smart city technologies has focused on the technical performance. For example, they engage on calculating how intelligent waste management system to recycle garbage efficiently, or examining how smart grid to allocate power to reduce consumption. When they consider impact, they usually measure it at city level. For example, researchers measured how AI-based transport system to relieve traffic congestion and reduce carbon dioxide emission. We can't deny that this research are not important, but we can also notice that this research are technology central rather than people centered. They more care about what technology can do, but hardly ever show us the residents' feeling or experience in such cities. And if the purpose of developing smart city to improve people's lives, then we need also capture the outcome at the resident level. Therefore, my research aimed to bridge this gap by integrating what data say with what residents feel into one holistic evaluation. Based on this situation, I put forward my research question is, how do smart city technologies influence quality life outcome for residents? And I pursue the following objectives. The first one is to quantify the impact of smart city technologies using standardized reliability indicators. And the second one is capture residents' perception or experience related to these technologies. And the third one is identify the mechanism through which these technologies affect quality of life. And the last one is develop a guideline for policymaker and urban planner to enhance positive outcomes. I'm using a sequential exploratory mixed method to meet those objectives and unfold in three phases. In phase one, I review the literature and the reports which published by government and the international organizations. Following Prisma guideline, I view research recent 10 years publication about smart city technologies and quality of life framework to build my framework. I will research this literature on the database, such as I explore Web of Science and schools. This phrase aims to identify the consistent theme and indicators within established framework, and do cross-evaluation with smart city technologies and quality life frameworks, and figure out the gaps of current research. Phase 2 consists of a set of semi-structured interview with two case holder groups in Christchurch. Group 1 include 5 policymakers who are involved in design smart city initiative and 5 technology professions who are responsible for provide smart city technology solutions. And Group 2 include 20 residents, diversity, age, gender, education, and salaries. The 20 residents just an estimate number. As you keep looking for interviewees until the salary is saturated. All interview will be held for 45 to 60 minutes. After transcribe it, I will code it systematically and apply SQL coding to build mathematical model and polish them, which I built in phase 1. Phase 3, which is based on the previous research, I will develop a questionnaire which is based on the verified happiness scale, such as WHO Level 5 Emotion Health Scale. A 7-item later questionnaire will be conducted on a representative sample of 600 to 800 residents, diverse in age, gender, and neighborhood diversity. Meanwhile, to be well, I will cite a minimal response rate, which is 30%. After conducting a pilot survey of 50 participants, I will distribute it at the community center, library, and other public places. This type aims to empirically evaluate the proposed framework. Until now, I finished the preliminary systematic lecture review, and I prepared the Prisma protocol for the phase 1 lecture review, systematic lecture review, and I also submit ethical application for phase 2 interviews. And I also estimate the cooperation agreement with city council smart city teams for a size of policymaker and technology professions. Thank you for your listening. Yes.